welcoming people as they come, but just in the spirit of getting right to it. So as most of you know, I'm Elizabeth Goldberg. I'm a volunteer with AIM Health Institute, Access to Integrative Medicine. It's my pleasure to welcome you today. AIM is a nonprofit organization with the mission to provide access to whole person health and wellness in the greater DC area, focus on low-income communities and community engagement, such as this event. And we're also thrilled to partner to make this happen, partner with the George Washington Office for Integrative Medicine and Health, which provides professional development, education, community outreach to improve health and wellness. And in our follow-up email, I will be sure to always include the links to our Facebook, Instagram, Twitter. Kind of been playing around actually with seeing if we can continue the conversation we have in these conversations that we have during these times and reflection opportunities, if we might continue the conversation on Facebook. I thought that might be a nice way to continue connecting during the week and receiving and connecting with each other, since I know so many of us are experiencing the sense of lack of connection and community. So something I've been playing with, be interested in your feedback. That being said, we're thrilled to offer these experiences for free and plan to keep doing so on Fridays at 2 p.m. Eastern. Please invite friends, family, colleagues from wherever they are in the US. We'd love to have them. So with that, I'm happy to turn this over to Dr. Deirdre Orceyre and Dr. Kaylan Baban, who are joining us today from the GW Center for Integrative Medicine and the GW School and the GW Chief Wellness Officer, who can speak a little bit to how she's doing today for her mindfulness session. With that, Janet, in case I missed anything, please let me know. I will turn it over to Dr. Orceyre.
Good afternoon, everyone. It's great to be here again as a facilitator for today's session. I'm just going to introduce myself briefly, and we'll do our introductions first, and then I'll spend just about 10 to 15 minutes talking about a few little updates, COVID updates, and then we can get right into the meat of today's session, which is the mind-body piece. My name is Dr. Deirdre Orceyre. Most of you know me already probably, but I'm a naturopathic physician and acupuncturist at the GW Center for Integrative Medicine. I do a lot of integrative oncology, functional medicine, general practice, and some teaching as well. So I'm very honored to be here. And that's me. Do you want to introduce yourself, Kaylan?
Sure, I'd be happy to. Hello, everyone. Dr. Kaylan Baban. My areas of practice are preventive medicine and lifestyle medicine. A great deal of focus within there on mind-body as an important tool in our behavior modifications and anti-inflammatory lifestyles. So I'm also thrilled to be here and so grateful to have been invited to be a participant in today's session. So thank you all, and I'm looking forward to getting a chance to practice together in a few minutes.
Great. Before we get started, I just want to mention if everyone could please mute, and maybe hosts, you could keep an eye on that because there was some background noise just then. So to hear if we stay muted during this portion. Okay, so I wanted to just give a few COVID updates. First of all, as we all know, there have been many gatherings in the form of demonstrations and protests over the past 10 days or so. And some people are very concerned about how that's going to affect our COVID numbers, particularly in this region where we had extremely large gatherings. And so because of that, Washington, D.C. is really extending their free testing for residents. So if someone's a resident of DC, and I actually don't know whether they're checking ID, I have to assume that they are, but there are multiple free testing sites available now pretty much every day of the week. And there are 5 firehouses that are doing it, and several DC sites. And so I'm going to include a link for that in the resources at the end of today's session. Also, Bread for the City, which is a DC low-income health clinic focused on services for under-resourced people, are opening up all their testing to DC residents as well. And I think that people just want to make sure that anyone who participated in the protests is able to get immediate testing. And also, even if there are no symptoms, just to get tested if you were down in the crowds. So that, and then also Montgomery County has opened up multiple free testing sites, and they're encouraging anyone that was protesting and out in groups to get tested there at their sites as well. In Montgomery County, they require a doctor's order and they require an appointment. So it's a little bit trickier. The DC sites, many of them are just drive-in. Some of them you can walk up without an appointment. So I'll give those links for everyone at the end of the session today, so you can take a look at that if you're interested. I don't know of anything like that in Northern Virginia. If anyone does, please let me know. I want to do just a quick review.
Deirdre, could I just add one thing about
the
DC testing? So I actually had several friends go to one of the DC testing sites and got there before it started, and actually before they got there was already around the block. DC had only allotted 4 hours for it, which is incongruous with the amount of people already know were there. So if you're a DC resident, if you could please contact your council member or anyone involved in public health, if you can just ask them to please, extend those hours and improve the testing, that would be greatly appreciated.
Yeah, and there's a few things going on in the chat box right now that are really good. I'm not going to go over them, but everybody can just take a look at the conversation in the chat box right now. Okay. And Dana, I do not know about reciprocity between DC and Montgomery County. Let's hold that question for our question portion of today. Just to review, I looked at the most recent numbers. So this is not always pleasant for everyone to hear, but I just want to go over it. In the district, there have been almost 10,000 cases diagnosed and about 500 deaths. In Maryland, there have been over 60,000 cases diagnosed and about 3,000 deaths. And for Virginia, the number is at 53,000 diagnoses and 1,500 deaths. So if we total those, it's 123,000 cases in the region and 5,000 deaths in the region. So just to give everyone an update on where those numbers are right now. Washington, D.C. is still in phase 1. There's some talk of phase 2, but we're not there yet. Montgomery County is in phase 1, although there's been a lot of talk, if you've been listening to the news, about moving into phase 2 within the next week. There's some pushback around that, so we'll see what happens. PG County, I believe, is still in phase 1. Northern Virginia is actually starting phase 2 today. And what does this really mean for us? In my opinion, I don't know, you could disagree, but it doesn't mean a whole lot personally. We still do the same protections that we've been doing for months. It's really for people who are business owners and people, it has to do with employment. So, or sorry, it has to do with businesses being open and people going to work. So if you're one of the people who now with phase 2, say in Northern Virginia, is going to be going back to work or seeing more people on a daily basis, you still want to practice the same things you've been doing, which is wearing an appropriate mask, and I'll talk about that in just a moment, and staying 6 feet or 1 meter away from everyone as best you can. And in certain situations, we can't keep 6 feet all the time. Like if you're in a grocery store and you're walking by someone in the aisle, or you know, certain places. And that's why we have the additional wearing a mask to protect ourselves. So we've got multiple layers in place of protection. So general recommendations are still, and this is from the DC, I think it's pretty consistent around the region, but general recommendations are still to obviously keep the social distancing when out and about, and to wear a mask at all times in any situation where you may not be able to social distance, where you may come in close quarters with someone else that's less than 6 feet distance. I wanted to also mention, I'm going to talk a little bit about masks. So the WHO just came out with some new information around masks that is not that mind-blowing, but it's interesting. So I'm going to review it. It's not like it changes things a lot, so I don't think it's going to require much different. But a couple of things to be aware of. Many people are wearing N95 respirator masks. So there are many different kinds of masks. There's N95 masks, and then there are certain N95 masks that have respirators on them, which are little boxes that allow air out of the mask. These are not appropriate for social distancing mask protection situations. And the reason why is because when we're social distancing in public and we're wearing a mask, what we're primarily doing is we're protecting other people from our possible infectiveness. And when you wear a respirator mask, you lose all of that benefit. A respirator mask allows your breath to leave the mask and go out. So while it does protect pretty well against droplets, it's not protecting as well as we would like. So I just want to mention that because it's come to my attention that many people don't understand the difference between an N95 mask with and without a respirator. So when possible, just use one without a respirator. Or, and this is what's actually recommended, is to use a cloth mask. And for the general public, that's what the WHO and DC and many other places are recommending. And I'm going to talk in a minute about, you know, how that mask should be made for best protection as we move into these broader phasing. Also, if you have a surgical mask, the ones that have the little loops, and you know what they are, they're fine to use, especially if you've been taught how to take them on and off safely to avoid certain types of contamination that can happen. So what I've done is the WHO has created several really gorgeous infographics about what to do and what not to do with both surgical masks and also cloth masks or homemade masks. And so I'm going to provide those in the resources so that you can just look at them depending which kind of mask you're using. And it's pretty straightforward stuff, but it's good to review it and make sure you're following good practices now that we're moving into, you know, more contact with other people. So what did the WHO say about how to make a good fabric mask? Basically, it reminds me of skiing. And the reason why is because in skiing, you have to wear clothes that keep you warm, but do not suffocate you or make you sweat like crazy. So that's the same thing with these masks. They need to have 3 layers. They have to have an inner layer that's pretty absorbent and wicking of the moisture, and that's usually cotton. So the inner layer should be cotton. And then they need a middle layer, which is strong and protective, and that's the polypropylene layer, but it still allows some passage, but not as much as cotton. And then the outer layer, the 3rd layer, should be something that is very, very protective. So it should be some sort of non-absorbent material like polyester or polyester blend. So we've got inner layer of cotton, a middle layer of a non-woven material such as polypropylene, and then an outer layer of a non-absorbent material such as polyester or polyester blend. So for those of you who are very crafty and good at sewing and know your fabrics, you'll know right away what to make. For me, I'm going to have to find somebody who makes them just like this. And I haven't yet had a chance to do that, to look on Amazon and do all the research. But if anybody else has, send me the links and I will send them to be sent out for everyone else. It's a fairly new, and this is a WHO recommendation based on some research that came out recently. There are some great graphics about different fabrics and so forth, and I can include those as well. So let's see if there's anything in the chat box that I have to respond to. Companies I recommend for masks, as I said, I do not know at this time because these recommendations for fabrics just came out. And we'll look at that link later. Oh, are people just talking about brands? Dr. Kogan, do you want to add anything? Do you know brands? Do you want to say anything about anything here? No. Okay.
Yeah, not really. I think the brands is a tricky one because we've been bombarded by so many advertisements, and probably a lot of them coming from China. I don't even know what to really say. Kaylan, do you know what MFA is getting? I don't actually know. I don't have a good answer for that.
Yeah, so what MFA is doing for providers or for patients?
For providers, I guess, for surgical masks, not for the...
Yeah, I think we have, I think we've been able to continue to use the suppliers that we have been using in the past. So we haven't had a disruption in supply in that way. But I would agree with your concerns. And I think there's been some research that's been done recently that has shown that a lot of the N95s that are commercially available for kind of individual or smaller purchases are not actually N95s when they're tested. And that's actually a majority of them. So given the option when buying something individually, I would probably also encourage, as Dr. Orceyre has said, the idea of just finding something, even if you're not able to get with the polypropylene middle layer. There's also some research that indicates that 4 layers of 100% natural cotton that fits around the nose and mouth well, perhaps has a kind of aluminum strip to fit around the nose, can also go a long way towards providing some good protection, and would be more likely to be what you think it is when you're purchasing it than an N95 or so-called N95.
Right.
There's a question about what if you are immune compromised. In that case, should one use a N95 in public settings for actual personal virus protection?
You know, the WHO had some specific recommendations for immunocompromised, and I can look at those and report back at the end of the session so that we don't take the time right now for me to find that.
And the problem with N95s, especially when you're walking or moving, is that they do obstruct the airflow quite a bit. So there's a concern for not necessarily suffocation, but for people getting lightheaded. There's been cases of car crashes because people couldn't really get enough oxygen to respond appropriately to more complex driving situations. So I think that's another part of the concern. So yeah, I don't know the immune compromised question specifically.
Yes, there's a question about WHO.
I'd like to wrap up the questions for now.
Okay, sure.
So, move over to our loving kindness meditation with Dr. Baban.
Great.
Absolutely.
Okay, well, there's obviously a lot to talk about. My thanks to Dr. Orceyre for covering an important update, and thank you, Janet, for keeping us on track. It's easy to lose track when there's so much to discuss. So I was so thrilled and honored to be asked to lead the mind-body practice for today. And on reflecting on the types of practices that have already been done for this group and the moment that we are in right now as a nation, obviously we've been all struggling through a few months now of the pandemic. I was about to say years. I think that was a Freudian slip. And now more recently, we've been having so much upheaval during our protests for racial justice. And there's a lot going on. And I think a lot of it has been, hopefully is going to be offering us some silver linings and some positive outcomes. But it's been a rough time, I think, in many ways for so many of us. So loving kindness meditation seemed like it might be a good fit for the moment. I'm going to just take a minute to share a little bit of background about the loving kindness meditation. I know it may be new to some folks, and it is a different type of meditation. So the loving kindness meditation, this is a practice that is tied with self-love, self-compassion, empathy, understanding, and kindness for ourselves and for those around us. So this is a practice that is meant to soothe the mind and to reduce the subjective feeling of suffering. This has grown out of traditional Buddhist practices, as so many of our mindfulness and meditation practices have in many different parts of the world, and is considered to be a pathway for cultivating happiness, appreciation, satisfaction, and acceptance. So during a loving kindness meditation, what we are asked to do is to commit some dedicated moments of appreciation, gratitude, encouragement, first for ourselves and then for others. There's some interesting research and some proven benefits here I won't spend too much time on, but just to say that as with many other types of meditation, there have been some very interesting studies of what is actually happening in the brain. What's been shown is that two different parts of the brain, the insula and the parietal lobe, these are areas that are associated with kind of processing of and perception of emotions. These parts of the brain actually end up getting activated faster during a loving kindness meditation than in other types of meditative practice. And so we can see that there might be some interesting implications there. Dr. Elizabeth Blackburn, who's a Nobel Prize winning researcher, scientist who wrote The Telomere Effect, she actually has done some original research that's fascinating that shows that telomeres, which are the protective caps on the ends of our DNA that either keep our cells young and healthy or associated with aging, those telomeres generally grow stronger with an ongoing meditation practice, but we actually see a statistically significant increase in the strength of and length of those telomeres with loving kindness meditation in particular. And there are interesting conversations to be had about why that might be, but it's also been associated in research with less self-criticism, more positive emotions, lessening self-destructive thoughts, and reducing pain symptoms and increasing resilience. And resilience in particular seems like it might be something that's useful at this time. So with that, I think this may be a good time for us to move into a practice. So I'm going to ask everyone to just make themselves comfortable wherever you're sitting. Chair, I think we're mostly in chairs. Cushion, if you prefer to lie down, whatever's best for you. Go ahead and just get yourself comfortable into what we would consider that kind of comfortable but dignified posture, right? And you can allow your body to settle in to whatever position you've chosen. If you're sitting, perhaps letting your hands kind of rest comfortably in your lap. You can gently close your eyes if that's comfortable for you, or if not, go ahead and just choose a spot off in the distance to use with a soft gaze. And just settle into your awareness of your body and of the breath. Allow the sensations that are in your body right now to come forward. Just notice what's there. And just try to keep yourself open to whatever there is to be experienced in your body at this moment. And we can turn our attention to connecting with the breath and just noticing the wave-like movement of the belly. And so in this practice, we are going to be cultivating loving kindness. And we all have within us this natural capacity for loving kindness. Sometimes we can feel that as friendship or care or love that is unconditional, open, gentle, and supportive. It's a compassion of the heart to ourselves and to those around us, with the wish that everyone be happy. We begin the practice by developing loving kindness towards ourselves, because we can't drink from an empty well. We allow our hearts to open with tenderness. So now, allow yourself to remember and to open up to your basic goodness. You might remember times that you have been kind or generous. You might recall your natural desire to be happy and not to suffer. If acknowledging your own goodness is difficult, try to look at yourself through the eyes of someone who loves you. What does that person love about you? It may help to use your imagination and to picture yourself as a young child standing before you. This may allow tender feelings of kindness to flow more easily. And as you are experiencing this love and self-compassion, notice how this feels in your body. You may feel some warmth or heat in the face. A smile may come to your face, or a sense of expansiveness. This feeling of loving kindness, this is naturally accessible to all of us, always. So let's just rest with this feeling for a few minutes. It's open, unconditional love. Letting yourself bask in that energy of loving kindness, breathing it in, breathing it out, and inviting feelings of peace and acceptance. And you can begin now to wish yourself well by extending words of loving kindness to yourself. I will be offering as guidance a few phrases that are commonly used in practice. You are invited to alter these phrases and choose whatever words express your wishes of loving kindness towards yourself and towards others. So offering these words in your mind for yourself. May I be filled with loving kindness. May I be held in loving kindness. May I feel connected and calm. May I accept myself just as I am. May I be happy. May I know the natural joy of being alive. Now that we have filled that well, now we can allow ourselves to focus on others. And we can open the circle of loving kindness by bringing to mind someone who is dear to you, someone who you care about, who has always been supportive. You can reflect on this person's basic goodness, sensing what it is in particular that you love about him or her. In your heart, feel your appreciation for this dear one, and you can begin your simple offering. May you be filled with loving kindness. May you be held in loving kindness. May you feel my love now. May you accept yourself just as you are. May you be happy. May you know the natural joy of being alive. And as we offer those words to that person dear to us, we can feel that further expansion of our circle of loving kindness. We can now expand yet further and bring to mind a person who is neutral to you. This is someone who you might see regularly, but don't know well. So maybe this is a neighbor or a grocery store clerk. Bring this person to mind now and repeat the words of loving kindness. May you be filled with loving kindness. May you be held in loving kindness. May you feel my love now. May you accept yourself just as you are. May you be happy. May you know the natural joy of being alive. And so now we have filled our well. We have expanded our loving kindness to those dear to us and those people in our lives about whom we feel neutrally but wish them well. And with each step, we can feel that sense of loving kindness becomes stronger and we have more to draw from. And so now, sometimes more difficult, if it's possible for you, we're going to take our next step and bring to mind someone with whom you've had a difficult relationship. Perhaps it's someone for whom you don't like to feel sympathy or compassion. It's maybe an individual in your life. Sometimes if we are experiencing chronic illness or chronic pain, maybe we have a contentious relationship with our bodies. In our present moment, maybe there are elements of our society, or even more broadly, that we can use here. With someone with whom we've had a difficult relationship, however it is most meaningful for you to interpret that. See if it's possible to let go of feelings of resentment and dislike for this person. Reminding yourself to see this person as a whole being, deserving of love and kindness. As someone who feels pain and anxiety, as someone who also suffers. See if it is possible to extend to this person the words of loving kindness in your mind. May you be filled with loving kindness. May you be held in loving kindness. May you feel my love now. May you accept yourself just as you are. May you be happy. May you know the natural joy of being alive. And we may feel that this can be more difficult. But we also know that when we engage with loving kindness, the more that we engage in the work, the stronger it grows in us. Now, allow your awareness to open out in all directions. Yourself, a dear one, a neutral person, and a difficult person. And allow your awareness to encompass all beings, humans and animals living everywhere, living in richness and poverty, in war or in peace, in hunger or in abundance, aware of all the joys and sorrows that all beings experience. As we come together in loving kindness to support our work and our mission, whatever it may be, let us repeat in our minds together. May all beings be filled with loving kindness. May all beings be happy. May all beings awaken and be free. May all beings be happy. And now, take a moment to just bask in that energy of loving kindness that our group here has generated today. And in a moment, when you are ready, beginning to wiggle your fingers and toes and prepare to bring the practice to a close by coming back to extend kindness to yourself. And when you are ready, you can open your eyes. So I hope that this was helpful. The loving kindness meditation, besides, I think, being a wonderful heart-opening practice, and besides having so much research behind it, is really infinitely adaptable. So I have had patients use this, as I described, to help them manage their own complex feelings towards their bodies. In recent weeks, I have had patients who have used this practice to manage their complex feelings towards our nation. It's really infinitely adaptable, and at times when our emotions can feel difficult to process, and we are struggling to access that sense of loving kindness, it can be a powerful tool. So I am grateful to you all for joining me in it.
Thank you, Kaylan.
My pleasure.
I think it's a perfect practice at these times. I think we have to start the kindness with ourselves before we can communicate it to anybody else.
Sometimes starting with the self is the hardest, but we don't get very far when we don't start there.
Mm-hmm.
Wise words.
Misha, would you like to take any questions?
Sure. I'm trying to see if there are any. I need to come back though.
Maybe Deirdre, you can field this one. There's one asking about the WHO making conflicting statements about asymptomatic individuals.
Yeah.
Right.
From what I understand is that a representative of the WHO, I don't remember her exact position, but she made a public statement very casually that it's very unlikely to get to contract coronavirus from someone who's asymptomatic, and it went viral. And it is an incorrect statement. I don't know the statistics, but a significant number of people do contract coronavirus from someone who is asymptomatic. It's not safe to assume that someone who's asymptomatic is not going to transmit coronavirus. So it was just a big mistake, and I think it's been corrected by the WHO directly.
Here's a question, and I promise this was not a plant from me. Under what conditions is it safe to get a massage?
That's so interesting. I probably will defer back to someone else on the specifics of this, but I myself have just opened my acupuncture practice last week. So I've now seen the same person twice in person for acupuncture. So that basically lit a fire for me of figuring out how to be extremely safe in doing so. And I think if we look at precautions that are used in a hospital setting for patients who do not have, who are not known to have coronavirus, we can learn a lot. And Misha, I think you had said something to me, correct me if I'm wrong, but wasn't there some study that showed in a general setting, doctors are unlikely to contract coronavirus if they use adequate face mask, if both parties use adequate face mask protection and constant disinfection and hand washing. Did you say something like that?
I may have. I don't remember. But
Yeah.
I think that early in the disease there were a number of transmissions to physicians, both in America and in China. I think once we sort of knew what we're against, I think the transmission decreased quite a lot. I think GW overall did reasonably well, actually, I think really well, of not having a lot of physicians contract it. I think it's all about personal protective equipment and knowing how to use it and proper hand hygiene. I personally think that going to any services, electives, any elective services, I think simply because I don't expect that somehow in the next couple of months things are going to change a lot. I think we have to start getting used to the fact that we have to sort of restart living as normal as possible, with a caveat of constantly using protection and having it in the back of our mind. I think what's dangerous is to forget it, and sort of like just what happened in some states where the Memorial Day hit and everybody were out and partying and not thinking. I think it's this not thinking will get us in trouble. I think the moment you're realizing and you're thinking about it and you're wearing the equipment, I personally feel like for things, otherwise we were going to start having healthcare problems from chronic conditions which we're not addressing. And somebody brought up the dental, I believe, and was there something else? I think it was a dentist. And now I have to scroll back.
Dental and eye exam.
Yeah, so like, you know, you don't want to miss those, especially if you know, if you're at the in a situation where you have to have those regular screenings done. And all those offices going to use appropriate protective steps, and they'll guide you through appropriate practices inside their offices. And I think whether it's acupuncture office or dental office or massage, I think all of those are going to be using relatively similar methods. I think the question of massage, whether somebody is putting hands directly on your skin, again, it's not any different from any other situations where there is a skin-to-skin contact for whatever the reason, whether it's a surgical exam or a neurological exam, or it doesn't matter. So, you know, it's still not necessarily answering or putting everybody at ease, because the reality is such, of course, you're going to massage to relax, and if you're laying there and thinking about, oh my god, I'm getting the you know, possibly exposed, you know, but we're gonna get used to this, and I think in reality, the sooner the better. That's the way I see it, because I don't think that we're gonna solve this pandemic quickly, but we have to keep on moving, and we have to use services that sustain us, and especially the ones that prevent illnesses, and screenings, and both primary and secondary prevention services. I think Kaylan probably can speak about this for hours.
I wanted to ask Elizabeth too, because the Massage Association probably put something out. So maybe after you, Kaylan.
Sure, yeah. Yeah, I think this is, it's a difficult question in part because the answer really depends on the individual. The guidance that I've been giving my patients just generally, and that I've been practicing myself, is to kind of ask the question, is it worth it? Right, so any potential exposure that we have, even if it's small, if we have a number of these potential exposures, they add up, right? But having said that, I think similarly to Misha, patients of mine who we have been kind of holding off on having them go to the lab or doing certain procedures, we're starting to reach the point where we're saying, well, you know, perhaps at this time, you know, it's been a few months, and that may change some, and it's likely to be continuing for a while, and that may change the calculus on the question of, is it worth it? But it does also mean that when there is an opportunity to be doing something that maybe isn't so important or so meaningful for you, that offers a potential exposure, maybe the is it worth a question is answered with a no, and that can overall help you to reduce your risk. But that's the sort of balance that I would recommend looking at. But I agree, we can't just keep deferring our preventive services and screening services. So we need to, on a case-by-case basis, evaluate that, and your providers can also help you to make that decision.
I think what's come out mostly in the massage community is risk mitigation. And similar to many other places, you know, screening individuals when they, you know, before they come, not having people waiting around in a waiting room, trying to kind of limit the types of contact we may otherwise have. So whether it's with, you know, checkout services or making new appointments, et cetera, and, you know, strong disinfecting, even more than normal, maintaining. I think the challenge is the actually on the practitioner side of the concern of the practitioner becoming some kind of vector. So the responsibility of, personally, I'll use myself as an example. I don't drive. So how am I going to get to my practice in a way where I can ensure safety for the people that I then work with there? Because, none of us live in, I don't work out of my home, there's not a sense of exclusivity there. So I think it's those types of questions that are up in the air. Obviously recommending that practitioners and clients wear masks is something that seems to be universally important. So, I think it varies in a lot of ways. They're doing, I think, the risk mitigation. The other question is, should we not have 90-minute appointments? Should you limit the amount of time? I think with doctor's appointments and other things, you have a more dentist even. You have unless you have really insane orthodontist, but much more limited time, whereas like a very, you are in a one room for 60 to 90 minutes with a practitioner is very different as far as exposure is concerned. So I think what, the community is thinking about the onus being much more on the establishment and the practitioner as opposed to the patient. And those are the questions that are coming up and that are important. And also sustainability, frankly, because if we can only have, let's say, 5 people per 1,000 square feet, which is what DC will be saying, for example, and, my practice is 1,900 square feet, how do we manage that? And how do we make sure that we follow guidelines and are safe, but also meet what our responsibility is to clients.
Thank you, Elizabeth.
I think the question of vaccine is very important. Kaylan and I were just listening to our grand rounds in medicine a couple of days ago, actually yesterday, I think. It doesn't seem like the vaccine is going to be ready soon. This also is not an easy vaccine compared to some illnesses, like, for example, flu, where we have an annual vaccine. So I think, unfortunately, it's not something that's going to occur in the next few months. I think 6 months, even that is probably hopeful and maybe unrealistic. We yet to see whether the vaccine is going to be effective and safe. I think there's a lot of hype around the vaccine. There seems to be every day there's something new about vaccines, both positive and negative. So I think we have to stay tuned. We have to sort of track official and trustworthy sources rather than Facebook. So unfortunately, there's no good answer to this question. So we have to wait, and until that point, our personal protection and distancing is really the #1 preventive tool we have. The question about the daycare, I think Dr. Orceyre answered really good, so I'm going to skip that. I think we're running out of time. Janet, do you have anything?
I think, if I may, there was just one question I saw that I imagine a lot of people may have that is easy and quick to address. If you're outside, how much distance you should be maintaining? Even outside, the recommended distance is 6 feet.
Okay, Elizabeth, do you have anything that we need to let our friends know about?
Not today. Just look up for that follow-up email and you can sign up right then, and look forward to seeing you next Friday.
I think in 2 weeks, when it's the 4th of July, we're not going to have it on Friday. So we're just going to start saying it today. We're going to have our usual Friday on Thursday, right, Janet? It'll be the same time, right? 2 to 3?
Yes. We'll make sure to let everybody know. All right. I wish you all loving kindness. Have a good weekend.
Bye-bye.
Same to you all. Bye-bye. Thank you.
Bye.